Okay, you are in the presentation working through grief and loss during a medical device purchase, and this is being hosted by iGaze Inc. and Unbox Therapy. I am Lana Ridge. I am a speech language pathologist, and on our panel, do you guys want to introduce yourselves?
Sure, I'll go first. I'm Lauren Halseal. I am a parent of a child with cerebral palsy that uses an iGaze system. I also am almost finished with my graduate degree in special education. Lana was my daughter's nanny when my daughter came out of the NICU in 2009. She was in grad school for speech therapy at the time. We worked together again when my daughter attended the Friends School, and Lana was a school speech therapist there. We've continued to be friends and work together as friends, consulting ever since.
My name is Stephanie. In spring 2017, I earned my bachelor's degree in communication studies with honors at San Jose State. Currently, I am earning my master's degree at San Jose State in communication studies, specializing in cultural communication of people with significant mobility and communicative differences and their autonomy, independence, and sense of self. I am completing my thesis on how people who support these individuals with physical and communicative differing abilities influence these individuals' autonomy, independence, and sense of self. To inform the scholars about these issues, I started a small business just a month ago, where I can educate people about AAC needs and the culture's beliefs in relation with significant mobility and communicative differences.
Hello, I'm Jeremy Van Trust. I'm a person living with ALS and a recent PhD graduate. I currently provide clinical social work services to others with ALS.
So I am an iGaze representative. I work in several states, and I have been working with assistive technology for over 10 years. And Lauren and I have worked together in the past. The learning objectives for this course are that you will identify 3 barriers to making a medical device decision. You will be able to summarize the 6 stages of grief as they relate to someone having a medical need for assistive devices. And you will also be able to list 4 best practices for helping grieving individuals through their medical device decision-making process. Since we were hoping that this was going to be a live panel and it had to turn into a virtual session, we decided to go ahead and put out a survey to have people be able to have their input shared. And we heard back from individuals who have made device decisions on their own, from family members who have helped make those decisions, and professionals who have helped make those decisions. We heard from people who have surgically placed supports, physical support such as wheelchairs or walkers, things of that nature, speech generating devices, and breathing supports. Everyone commented that they felt overwhelmed. They had a range of emotions from excited to happy, eager to sad, hopeful to scared, knowledgeable, grief, depression, upset, and anxious. Several mentioned that they felt a sense of loss, and none of them were diagnosed during the time of their device decision-making process. Some of the ones that we'll talk about later on are the sense of loss and the overwhelming feeling. So loss can make people grieve. Loss and grief tend to go hand in hand. You can have a loss of cognition, which would make you have a need for a medical device, loss of mobility, loss of independence, loss of speech skills, and loss of body functions. All of those could lead to needing a medical device and can also lead to grief. How can loss affect your reasoning skills?
Yes, in working with people with ALS, I've seen how loss and going through the stages of grief can affect people's ability to process information and make it difficult for them to make decisions. Many people with ALS are struggling with progressive loss, so they feel they never can catch a break and are constantly bombarded by it. So reasoning with real world decisions is challenging.
So here we have the intervention strategies Some of you may have seen this before. You have pre-contemplation, where someone is not engaging in a decision at this point. Intervention strategies are education. So why would you need a device? Increase in the importance of their belief that it's helpful, and possibly rewards. Then we move to contemplation. So they're not making a decision yet, but they're going to make a decision in, like this example says, within 6 months. So again, we're adding more education, we're increasing the importance of it, maybe adding more rewards, and making sure that they're aware of their current behavior. So if someone is having more and more trouble walking due to the progression of their disorder or disease, then maybe we say, typically someone with this disorder or disease will have much less use of their legs within about 3 months. So we want to make a decision soon. So trying to help them with that. Preparation. So now you're adding in more awareness of their current situation. And we definitely want to make sure that they have an accurate picture of what their skills are at this point, or what their body can do at this point. We're moving them towards action. So we're wanting persistent visual feedback. For this one, that was for exercise, but keeping track of your progress. So if I've had 5 falls in the last 2 days, and previously I only had 5 falls in a month, well, now we know we're having an increase in issues. So we might need to look at a wheelchair or a walker support. And at this point, with action, that means that they are at the point where they are ready to make a decision. And maintenance is helping them continue to use that walker or wheelchair, overcoming any problems that arise, making sure they're talking to the company if there's any issues. So part of the decision-making process is not just one person. We have a lot of people involved. We have family members, we have friends, we have the person who has the need for the device, we have the professionals who are recommending the device, we have your doctor who typically has to write a prescription for the device. There are the reps from the vendor companies that are also all part of this decision-making process. And anyone in the decision-making process dealing with grief about this decision can halt the process. So I was working with a family where the wife was grieving, and she had a really hard time accepting that her husband's skills were declining, and that froze her decision making. And she, as far as I know, to this day still hasn't made a decision. We've worked really hard to try to help, but it was something that she was not ready for. And Stephanie, I'm going to be quiet so you can finish typing, because it looks like you would like to say something on that one.
The stigma around people who have differing abilities is so strong and embedded within our culture that they often choose being vain over choose using assistive technology. Since having support needs have so much shame and stigma, it highly influences decision-making and reasoning abilities.
Yeah, I hadn't thought about that.
Yes, this goes back to my previous comment. I think many people get stuck in the grief stages, which makes it difficult for people to move forward, particularly to make decisions about things. I think it's important to have mental health clinicians working in tandem with allied health professionals to help them through the grief process so the patient can make informed decisions.
So most of you are probably well aware of the stages of grief by Kubler-Ross, where we have denial, anger, bargaining, depression, and acceptance. And if you remember studying those, hopefully you remember that those can come at any point. They can go in any order, and they can be together at the same time, and they can keep cycling through however. David Kessler also added a 6th one, finding meaning after loss. So after, a lot of times they're talking about the loss of a loved one. So finding meaning after the loss of a loved one might look like you do a new charity in their name, or I know people who have gone into new careers based on the loss that they've dealt with. So it could be different for any of our clients. One of the things that David Kessler has talked about recently in 2020 is anticipatory grief. and how a lot of the anxiety that we're going through in 2020 is this anticipatory grief. What if I get sick? What if I lose the ability to speak? So for our clients, it would be, what happens when this disease or disorder gets worse? What happens when I have a care provider that I don't like and I can't communicate that? There's all kinds of anticipatory grief or anxiety that can go along with any one of these medical device decisions. Some of the ones that we talked about in the survey were surgical supports. So anticipatory grief and anxiety that can go with those is, what happens if my pump quits working? What happens if my pacemaker is not working correctly today? What happens if my vital stim system is not working? So there's all kinds of anticipatory grief and anxiety that can come with that. One of our participants, I did an oral presentation with him, and Larry Baker shared that there's sometimes a skewed idea of time, where when we're in grief, we might not know whether it's been a few weeks since we started grieving, or if it's been a few months since we started grieving. So that skewed sense of time can also affect our ability to move through the grief processing. Denial in the case of medical devices can look like someone not feeling as though the device is needed. It could be a caregiver that doesn't want to admit that this is something that's necessary at this point. It might be the individual who is not willing to accept that they need more support. There could be anger in that they don't want the device. I don't want it, not that I don't need it, but I don't want it. I don't want to look different. I don't want to admit that my body can't do what I want it to do. Bargaining can look like, unfortunately, I've seen this a few times, where if I just do the right rehab, or if I just do the right therapies, or I do enough therapies, maybe I have the individual in therapy every single day of the week. Maybe they have multiple therapies every single day of the week. If I do that, then can I avoid getting the device? Or can I take enough medication or enough different medications so that I don't need the device? Those are some of the bargaining indicators that I've seen when it comes to grief in those medical decisions. Depression can look like apathy or a lack of motivation to move forward with getting a device. You can absolutely see tears during this time, but you can also see just a stagnant state where someone is not ready to move forward, where they're depressed, they're not ready to accept, and it's not that they're angry about it, but they just can't move. They just are stuck in that decision process. And then, of course, the part where we're trying to move someone to is acceptance, where they're ready to move forward with the purchase of the device, but not just the purchase of the device, but also the training that's necessary and needed for accurate use of the device. So if someone's ready to get a device, but they're very hesitant on the training portion, then we still have some education to do. We still have some of those motivational interviewing techniques that we might want to try. So what are some of the best practices for making sure an individual and their family are ready and willing? Let's look at some of these. So Prochaska and DeClemente talk about the cycle of change. And we talked a little bit about that before, but there's also this idea that you can have a relapse and go back through that cycle of change all over again. So you could fall back into a pattern of being super dependent on other people and not necessarily wanting to use the device that you have. So we need to kind of keep an eye on those as well. Most of us, in terms of companies like iGaze Inc., might not see the relapses or those times when we need to learn again, but staying in touch with people that know about your device decision can help, and reaching out to people who were part of that decision in the first place and saying, hey, I'm really struggling, I'm having an issue, and maybe it's a problem with the device that you need to have fixed. So you can definitely reach out to people and talk to them.
Yes, I've seen learned helplessness as well. I think that is common in people with ALS. I think some people, especially those experiencing progressive loss, eventually throw their hands up in the air and tell themselves, well, what's the point? I'll just keep spiraling downhill anyways. So
Mm,
they become more and more dependent on their caregivers and less dependent on problem solving to maintain a level of self-sufficiency.
I know there's a client that I worked with was on that on that downward spiral, like you said. And for some reason, her home health agency was having a really hard time getting her G-tube feedings, like the actual formula. And I think it was just the straw that broke her that weekend. There were just so many things that were going downhill for her. And I was supposed to come and visit her so that we could set up her communication device. And she was not interested in doing that at all. And when I talked to them a couple days later, I said, I'd really like to come out. I'd really like to make sure that we can get this set up for you so that you can have whatever communication you want to have. I understand that things are going downhill, but that doesn't mean that you shouldn't have the ability to communicate. So they agreed to let me come out, and they said she was about to give up a couple days before that. And there's no blame on my part. I'm not blaming anyone. But that's reality. We don't always see that as clinicians. But yeah, she ended up using the communication device, and she was doing great, and they were able to get all the stuff figured out. That seemed to be the turning point for her, when someone else could take on that load, because her load was heavy enough. And so when somebody else could do the problem solving, that seemed to benefit her the most. We also talk about the desire for change and the ability to change. So one of the things we want to know when we're talking to a family is, what's the priority? Do we want the priority to be independence? Is the priority being able to talk again? Or it kind of depends on each individual client. And whose priority is it? Because it really matters what the person who needs the device, what their priority is. So, Lauren, would you share a little bit about how the wrong priority can kind of dramatically affect how everything goes?
Absolutely. We were in a situation when my daughter was post-op with a new muscle relaxer device that was supposed to really improve her spasticity. And just a few days after the operation in the rehab department, we had a representative from a local company that sold, medical equipment, came in and really pushed hard for a mobile chair, because, oh, her arms are going to work now. Now you can do this and that, and she'll have independence at 5 years old. And you'll be able to do this, without us being able to step back and look at, okay, where is she actually at in terms of what she's able to do? Where do we see her in a week, a month, 6 months, as far as actually being able to use this device, rather than being preyed upon by, oh, guess what? She can do all of these things that you've been told she can't. Let's push this $35,000 wheelchair. And we were really taken advantage of, because they played on our hope for her ability to be independent in ways that we had never imagined. And, it ended up being not the right fit. And we were stuck with a chair for the next 5 years that, she couldn't use. So that also kept us from being able to get a chair that we actually needed because of that. But that person was allowed to freely roam on the hospital floor, and that was like a normal practice at that facility, which isn't right when parents aren't given real options that actually make sense for the current situation.
Mm-hmm. Yeah, and at that point, the priority was get better after surgery.
It should have been. She was still learning how to sit up, and yet we were being pushed for really expensive equipment to be pushed through, based on her change in ability, which we didn't even know what that was yet, because she was still on very high painkillers for, spinal cord surgery.
Right.
So, the priority was definitely the salesman's and not, what's best for the person that just had, surgery.
Mm-hmm. Yeah, so sometimes we can be a little too enthusiastic about change. So one of the things that you can kind of ask, I'm guessing most of you are therapists that are watching this. If your family members, fantastic. Please advocate for your stage of change, your readiness. One of the things that some of our clients might find helpful are some of these visuals that I have in the presentation. The readiness ruler. Maybe your client just isn't ready. Maybe they're just not there yet and they need some more time before making a decision. That should absolutely be their right to need more time to make a decision. So go back through some of the visuals that we've provided, go back through some of the questions at the end of this and see which ones you can pull out and use in your situation. And if you're a family member who feels pressured by a therapist or a medical professional or a vendor or a representative, pull out some of these things and say, look, I'm not there yet. I need you to take a step back and look at some of the research, and I'm at this stage and you want me to be here and we need to talk about this. So use some of these visuals to your advantage. So sometimes we run into situations where as therapists, we might see the benefits of change, but our family the clients and their family members don't necessarily see the benefits. So sometimes we'll talk to a family and say, like one situation I had was a spouse was anticipating all of her husband's needs. And so she didn't see any reason to get a communication device. But any of us who went into the home could not understand him. And we didn't know him well enough to be able to anticipate his needs. So we talked about the benefits of changing versus not changing. If you don't get a speech generating device, then when you go to the doctor's office and the doctor can't anticipate your needs and your thoughts, then you might end up with a medication you don't want because you can't communicate to the doctor that you don't want that medication change. So our big education, like we talked about earlier, was making sure that they understood if you anticipate his needs and that works for you, great. But we also want him to have a way to communicate with people outside of just the two of you, because he does go to doctor's appointments, he does see therapists. And one thing we found out was that morning she had given him orange juice and he actually wanted apple juice, but he didn't care because he knew she was being nice. And we said, that's fine that you're being polite to her, but it's also totally fine for you to say what kind of juice you want in the morning. So looking at some of those benefits. Linda Van Dyke wrote a book on grieving, and she also talks about how if you don't know the likes and dislikes of the individual you're working with, that you might not be able to find that piece of information that you need to help them want to make a change. You might not find what's most important to them.
Without appropriate communicative support, it often creates and reinforces the codependency between the client and the personal care support systems, which enables the power imbalance.
Mm-hmm. Yeah, definitely. And that's an important part for people to know. It's not always easy to have that conversation, but it's an important one to have.
I like how you started WTH where he was at, which ended up expanding into other forms of communication organically. That is awesome.
Here's another visual you can use to ask somebody, where are you right now? Kind of gives them a chance to look at something and point instead of having to come up with the words themselves. One of the things that we talked about in the survey was this sense of overwhelming. And I think any of us can feel that way with big decisions. And this is absolutely a big decision. There's multiple ways that we can help lessen the overwhelm, that overwhelming feeling. And there are things called feature charts. And I don't know if everyone's aware of that, but feature charts allow you to look at what each device does. So with wheelchairs, you want to know, will it recline? Will it raise me up? Will it easily be easy to get me out of it? Or if you have some hand strength and arm strength, am I able to push myself in and out of the chair? There's all kinds of things that you need to know when you're making all of those decisions. So feature charts are one way to help. And I think one of the trickiest things about feature charts is who created it, because it might not be completely accurate. And I don't know that everyone who creates a feature chart is trying to be inaccurate, but there's so many changes that happen with any device and the different companies that you might not be able to stay on top of it. So a feature chart that you made a month ago might change, especially at ATIA. A lot of places like to roll out their new products or their new software or their new hardware, the new changes they made. So feature charts have to be updated. And that rarely gets done from what I've seen, at least. If you know of a place that's keeping up with feature charts and keeping them accurate, by all means, please send that our way. We would love to be able to share that with individuals. One of the things that I think people aren't made aware of is that trials are an option. Some companies might not have a lot of extras, so you might have to spend more time with the representative from the company. And certainly with surgical placements, you're not necessarily going to have trials, but you should be able to try out the system or the device that you're going to use. You should be able to have a demonstration with a company representative. Somehow you should be able to see that it works before you move forward with the process. Multiple exposures to it. I know James at our main office likes to talk about car buying. Would you go out and go to a car lot and say, yep, I want that one right there today, let's go? Most of us wouldn't. Most of us do our research. You're probably going to go to multiple car dealerships to see who has the best deal, who has the features you want, going back to that feature chart. If you really are in a cold area and want heated seats and maybe that heated steering wheel, then you're going to make sure that the car you have has those features. But you also are probably going to test drive it. That goes back to the trials. And you might go to one dealership, go to another, try out another car, come back to that first dealership and try the car again. So multiple exposures are not unrealistic expectations for people to have. You might say, you know what, I've tried 3 different devices, which that idea of 3 within insurance, at least for speech generating devices, insurance wants to see that you've tried 3 devices. It's okay to say, I've looked at all 3 and I'd really like to look at the first one and the third one again. Or I really want to see the second one, but can I have 2 hours with it instead of just an hour? It's okay to ask those questions. Another thing that can help is finding support during the funding process. Most companies try to have the funding process pretty streamlined at this point with computers and document sharing and that kind of thing. But if you need help during funding, please know that you can reach out to those companies. And if they're not helping you with the funding process, talk to your therapist, talk to your medical professionals and see what's going on. Should they be helping me with this? Is there a reason why they're not more responsive? So the other things with funding are sometimes there's grant organizations that can help you with funding. So reaching out to those kind of supports are really important. With any device, you need trained. You are not the professional on this device. Like I said, there's probably changes since the last time it was there. If you're having a surgically placed one, they train you. They make sure you know what you're doing. They make sure you know when you have to come back to the office. So making sure that you have training before, during, and after the purchase. You need to make sure that when you have questions, those questions can get answered. As therapists and medical professionals, we need to listen. We need to take a lot more time to be quiet and listen. Be patient with the individuals. If they are grieving and they are feeling that sense of loss, we need to be a lot more patient with the time it takes for them to look through all those feature charts, for them to look at trials, being okay with them taking longer to go through that process and make a decision. And any of us in any part of this decision-making team need to advocate for the person who's getting the device. We need to advocate that their opinions matter, that they should be asked what they think. And of course, if it's a young child, the parents are going to have a lot more say over it, but then make sure the parents are having adequate information.
I just want to jump in on that. Make sure, especially if you're a therapist or a company rep, that you don't give the parents only one option and don't allow them to search out different companies and different features in other products, even if that's your favorite to work with. We weren't given options on a communication device for my daughter, and somehow she got it funded even though we didn't try 3 different devices, and now we're stuck 2 years later with a device that really isn't working properly and that we have to keep sending in for repairs, and my daughter's going without a voice. So even if it's your favorite and the product that you prefer, make sure that you give the client multiple options from multiple companies just to make sure that they are making the right decision for themselves.
Yeah, and we had an unfortunate story that came through our office that the individual had tried 3 different systems at a conference, kind of like ATIA, and it might have been a symposium or something like that, but they had tried more than one device at that symposium. And when they went back to their speech language pathologist, they said, I really liked this device. And the therapist said, that's nice. You're not getting that one. You're getting this one because it's a better system. But that should never be our say as medical professionals. That medical professional did not listen to the desires of that individual. And when people are ignored, that risk of device abandonment is going to go sky high. And I'm sure there's a class on that at ATIA this year. If there's not, I'm sure you've been to one. Abandonment is a huge issue. And if we can kind of go through some of those things ahead of time, where we can train, we can listen, we can advocate, and we can be patient ahead of time, then we are going to lessen some of those abandonment issues. So you're absolutely right. Listening to the person who's getting the system is absolutely critical. This is a visual that James Brenton, speech language pathologist, has created. And we talk about how, so that 3 device idea with speech generating devices for insurance purposes, it's not, this is an example that I shared. So going back to that car dealership idea, because most of us have been through that kind of experience. So if I go to a car dealership and I say, I need a vehicle that fits my family, it has to fit at least 6 people. And they say, okay, well, I have a car that fits 5 people. And then they say, I have a van that fits 6 people, and I have a truck that fits 2 people. Well, technically they showed me 3 systems, or three cars. That tends to be the way a lot of therapists are doing device trials. There's only one choice for my family in that situation. It'd be the van. I can't fit all of us in the car. I can't fit all of us in the truck. So that feature matching is an issue here in devices as well. Showing them 3 devices that actually meet their needs and that they can actually access is absolutely important. So I know that it's been shared with me in the past that if they've ever tried an iPad or some kind of touch device, count it. Well, in this model, we're saying, no, don't count it, because if they can't access that touch screen, then it's not a true trial of a good device fit for them. So each of those devices should be something that works for them. And each of those devices, in our opinion, should be from different companies. You should have different hardware that you're trying. You should have different software you're trying. And clearly that's with communication devices. And I don't know about all the different device purchases and what their requirements are for insurance, but from what I understand, you should definitely be looking at more than just one option. Even if it's a surgically placed support, there's more than one hardware solution out there. So make sure you know what your options are. So going back to that data collection, you're wanting to know that it is meeting the need of the patient. How was their experience, their preference? Going back to that story, that their preference was ignored. We don't want that. Any physiological considerations. And then once the device is selected, you go through the documents, and then you get that training and ongoing tech support. So that is for us a balanced system where if you take out one of those pieces, the whole thing tumbles. And that's what can happen with our device purchases. Okay, so here we have motivational interviewing. This is another idea where if someone is really struggling to move forward in the process, this is called rule. So resist telling them what to do. Our therapist should not be telling us what to do. I have one therapist that I've worked with, and she says, I absolutely refuse to tell you which device to purchase. And I think that is one of the most ethical things I could ever hear. You should not be telling them exactly which one to get. It should be their preference. Understand their motivation. Seek to understand their values, their needs, their abilities, their motivations. I had one client that he was completely motivated to use his speech generating device to boss his dog around because he hadn't been able to give dog commands to his dog in years. And that was important to him. So we made a whole page on dog commands. That is not core word page at all. And I know a lot of people are pushing core words right now, but making a page just for his dog commands was absolutely important for that individual to have quick, easy access to exactly what motivated him. Listening with empathy, listen in general, and empower them to achieve their goals and identify how to overcome some of the barriers that they're facing.
Yes, I found in my research that motivational interviewing can be a very powerful intervention that can help people make decisions without telling them what to do. This is really important with people who have speech limitations and need assistive technology.
That's awesome. What are some of the ways that you see people doing the E, where it's empowering them instead of whatever else? What are some of the best ways you see people empowering others?
Well, I think the most important part of empowerment is to remove the barriers that prevent them from getting what the patient wants or needs. Those barriers can include limitations related to financial resources, insurance, caregivers, or even lack of confidence in such. I think we need to do a better job at helping them remove barriers.
That's a good point. If you're still struggling with knowing how to do that motivational interviewing so you can get the information out of the individual that you're looking for, here's another way to do it. There's asking permission, like, may we talk about the fact that it's really hard for you to move around your house right now? An open question. What do you know about speech generating devices? Closed question. How much do you fall when you're in the bathtub? Maybe we need to look at a bath chair. Telling. So if somebody's struggling, the example here is diabetes, but informing them. Not doing something is going to cause what? Giving feedback. With respiratory devices, I know some people are hesitant to do CPAP machines or things like that. Well, your tests show that having a CPAP machine would make it easier for you. Advice, listening, going back to that. So appreciating. You are very courageous to be going through this grief and going through this decision-making process, reflecting. You want to change, but something's holding you back. Summarizing. Let's see if I got it. That's an important one that I think we should have a lot more often in our conversations when we're dealing with these huge decisions. Summarizing, because maybe you didn't get the important stuff that they feel like they wanted to share. Okay, so what are some of the best practices to make sure that the device is the right fit? We've talked about that a little bit. I want to show you something from Lisa Bardock. She has a communication needs questionnaire. And one of the things that I like about it is, see, there's place for 5 different systems, not one. You're not seeing it on one system, you're seeing 5, and there's room for more. You can put another column on there. Going down here. Oh yeah, and she works for the ALS of Michigan. So if we scroll down here, this is another huge important piece in my opinion. This is how important are these features. So this is one type of feature chart or feature matching. So before they ever look at a device, how important is communication? That would be communication face to face in the room. How important is emailing someone? How important is internet access? Going through all those. Let's skip down to games. So one of the examples that I was sharing earlier is if you rate games as a 1 and then a rep comes in and they're really excited about these new games that they put on their system, the software improved, and they just really think the games are cool and they honed in on that. And then your client comes back and says, well, you know, I really like that system that had the cool games. And you go back to this and you say, well, when you first came to me, you said that games weren't really that important. Has your number changed? Or do you feel like you were being influenced by the new software that came out and that's not actually something that you want? So that's a conversation to have. So being able to rate it, because if you said text messaging is a 10, that is the most important thing for me, but this device that has these cool games is insanely difficult to text on, then maybe you haven't found the right system. So then you go through, once you've seen the systems, and you rate the effectiveness of each of them. So how easy was it for me to email? How easy was it for me to text? And she does have some tips on there in case you need it. But this document is available. It's in our resource section at the end, and you can also find it at the ALS of Michigan site. So there you go. You've got different devices. You have more than 3 even. So great opportunity to do some feature matching and make sure that it's meeting the needs of the individual and what's working best for them. One of the things that I think can be a challenge, depending on where these decisions are happening, is who can be a part of the support system. It seems like sometimes home health has access to case managers, where sometimes a hospital might have access to counselors or spiritual supports. They also tend to have case managers, but they don't seem to share that information a lot. In another facility, you might have better psychological or psychiatry help. So I think some facilities have a better handle on some of these support teams members than others. But these are some of the people that you can reach out to if you're having trouble. So we definitely want the individual who's making the decision. We definitely want any care providers to be a part of the team, and we want family members to be a part of the team. But these people can also be a part, the social workers. Grant organizations are another one that I think we tend to leave out, but if financial strain is causing the majority of their grief and loss, then we need to be talking to grant organizations or steering people towards certain grant opportunities so that they can lessen that financial burden. Larry Baker shared that with their Lovability ministry, once they became well established in the community, group homes would call them and ask them to come help individuals that were dealing with grief and loss. And he mentioned that there was one individual who came to their ministry, and the majority of the time someone would have to end up restraining the individual by the end of their time together. And their ministry realized that he was dealing with a lot of grief and loss in his life, and they helped him process that grief and loss. And he ended up coming to the ministry and saying that he felt relieved, and they no longer had to restrain him. He was no longer on heavy medication, and he was able to be the person he wanted to be without scaring people when he came into a room, because someone actually listened. Someone actually spent time getting to know his needs and his wants and his desires and listening to the grief that he had in his life. So his wasn't necessarily a story of devices, but it's incredibly important to have that time to listen to someone and help them move through that grief. And if you're not the right person to do that, help them reach out to somebody else who can.
I think grief and loss are so important in my experience. clinics tend to treat PRFN loss just after diagnosis, but they don't do the best job at treating it throughout the duration of the patient's disease process. So I think more focus should be placed on treating it on an ongoing basis rather than at the onset portion of the disease.
Yeah. Yeah, I don't know that I've seen a single person that's been getting ongoing support like that. I've seen support come in at hospice, and I've seen support come in when you're in the hospital. Other than that, I don't think I've seen people get help. So these were some of the ones that we mentioned. And I also said that it seems like some clinics or hospitals or home health agencies are better at supporting you in one area versus another. But it seems like overall, most of these people don't get included on that support team. Do you find that people are more apt to talk to you since they know you understand what they're going through instead of somebody who's like basically book smart about it, but otherwise clueless?
I think so, but it's hard to say. Some people feel like talking to me because I'm going through the disease as well, and they think they are burdening me with their problems. So it's not a perfect system, unfortunately.
Did you guys have anything else you wanted to share before we end?
No, I think you did a really great job encompassing all of those steps.
Okay, thanks. So while you type, Stephanie, I'm just going to do this last little snippet because I can move around our audio as we need to. So thank you so much to everyone who's been part of this discussion. Like we said, we really wish this could have been live, and hopefully someday we can do this live so we can have participation from the audience. But those of you that took the survey, we really appreciate your feedback so that you could be part of this discussion in your own way. Lauren, we really appreciate your time. You have dealt with a lot of medical decisions in your life, and we appreciate your input on this topic. Jeremy, thank you so much for what you can share with us from two different standpoints. Stephanie, we really appreciate you being here and sharing your input. I know the studies that you're doing right now are incredibly important, and I hope more people are able to take that point of view of how is our society handling grief and how is our society handling device decisions. Thank you to Larry, who had a conversation with me prior to this. And thank you to iGaze Inc. for hosting this so that we could have this topic shared at ATIA this year.
I want to add, when the client decides on who can be support team, I feel it is important to decide whoever is genuine about giving them appropriate support. I noticed that when the team is not genuine, the client can be disempowered.
Yeah, that is a great point. Yeah, definitely. And like I said, sometimes that's tricky when we have kids knowing how best to have their input in their support team, but absolutely people should have a say as to who is on their team. We're just trying to give some ideas of maybe some people that we don't always think about who can be added to the team. All right, here are resources. If you need any of the ones that we had on here, you should be able to find them in this resource list. If you have any questions, feel free to reach out to us. You can reach out to iGaze Inc. And we can do what we can to help. Thank you so much for being part of this discussion on grief. I feel like it is an incredibly necessary topic to discuss. I don't feel like it's discussed enough within these decisions. I feel like we tend to think, well, just make a decision and move on and let's get to it and get to our goals. But I think sometimes we minimize the impact that these decisions can make on a family and how critically important it is for all the steps to go into making these decisions and not skipping steps and not trying to rush through the decision. So hopefully you have somebody in mind, or you have a strategy that you want to try, or you have somebody you want to reach out to now to add to your team, or maybe you have somebody you want to take off your team that you're like, you know what, I don't think you're the most helpful person for this team. whatever it is, I hope there's something that you're taking away from this discussion. Even though we couldn't have it live and we can't answer your questions in real time, I really hope that there's something in here that stuck with you and that you can put into practice, hopefully today. So thank you so much. We appreciate your coming, and thank you to everybody who's taken part in sharing this information.